So I mentioned before that I work a lot with the National Cancer Institute as one of our clients, and smokefree.gov is an initiative that comes out of the National Cancer Institute, out of the Tobacco Control Research Branch. And the whole idea of this is not prevention of smoking. It's not trying to scare people away from smoking like some of the other government agencies' campaigns do. NCI is not focused so much on prevention. It's really about providing resources to people who are ready to quit smoking. So to give you that context, when people come to smokefree.gov, the idea is they've already made the decision they want to quit, and it's about how do we help them find the right resources, get support throughout that process, deal with cravings and all that sort of thing. The website, smokefree.gov, it has sister sites that are focused on different audiences. So there's a women's site, there is a Smoke Free Espanol site, there's a site for veterans, and there's also a site for teens. And so through many social media channels and different communication outlets that this initiative has, we've tried to reach those different audiences. But one that's always been a little elusive for the government to tap into is that teen audience, and getting a lot of engagement from teens, whether it be through the website, apps, or social media. So a while back, NCI partnered with Health Corps to design an app that was meant to help teens live healthier lives. So they learned through a lot of different research and some of their own communication programs that they had put out that teens didn't necessarily react real well to a lot of the smoking cessation messages, that they actually would engage a little bit better with messages about healthy lifestyle in general and healthy living in general. So the idea was to find a way to deploy content and get teens engaging with content that was going to help them lead healthy lifestyles and therefore not start smoking or quit smoking, or help them through the process of quitting smoking, because they have all these other healthy behaviors that really help you when you're trying to make a big life change like that. So this app was a great app. It had great functionality. You can see it did basically daily challenges that teens could select. I'm going to use items around the house to work out for 30 minutes, and they could accept that challenge and then track all the challenges that they had done on the app. There were leaderboards to compare what they were doing to what their friends were doing. A lot of great features in this app, but it didn't see widespread adoption. Even in the Health Corps schools where they were helping NCI promote the app, teens just weren't really engaging with it, and eventually the app went away. But we had this great basis of all this health challenge content. So the idea basically was we wanted to figure out a way to take the health challenge content that we already had, that we put a lot of effort into, that we knew was good content, and find a new way to deploy it that might be more effective. And the original thinking was maybe we need Momentum App 2.0. Maybe the app just did too much, or there was something wrong with the app. We need to figure out a way to build a better app. So we had, late last year, we actually went through some of the old survey data, some of the qualitative feedback about the app. We found out things like teens really don't want to do daily challenges. They're busy with sports and lots of other pressures, and it was too frequent. We found out that they really didn't want to download an app, and in fact the population in general is downloading fewer apps. I think there's some research out there that shows people use the same 4 to 5 apps every day. Most of you aren't downloading a brand new app every single day. There's kind of a big barrier to entry there. And also there were issues with some of the teens that we wanted to use the app. They didn't have data plans on their phones necessarily. The school principals had banned them from using phones, and we were trying to communicate to them through Health Corps representatives at those schools. There were several issues that, through user-centered thinking, maybe we would have been addressed a little more upfront. So we went back and looked through all of that data to kind of inform some lessons learned, exercises, and then went through the design thinking process to capture new ideas based on having that knowledge now. How can we take all that great health challenge content and deploy it in a new way that teens will engage with? And we captured some features that we thought must-have features, right, based on our knowledge of teens. People in the group had children who were teenagers. Based on what we thought teens wanted to do, we captured some great features. And we still left the meeting thinking, well, maybe we do need to build a better app, but it needs to incorporate these features. Or maybe it needs to be a mobile website. We're constantly pushing for more responsive design mobile websites, fewer apps. I was reading an article today that Great Britain the government banned all apps. They're not making any more apps at all. They're going totally to responsive websites. So we were leaning in one of these directions, and as we started building out the feature set and concepting a little bit in subsequent meetings, we came up with a couple of prototype ideas, and this is where we wanted to make sure that we were incorporating the user-centered design once again, right? We wanted to go back to the audience before we started investing a lot of resources in building some new thing, constantly, frequently go back and test our ideas. So that we don't end up with another app that no one's going to adopt. So when we talk to teens about whether or not it's going to be an app, and we did this through pretty informal testing, some hallway testing, some testing at malls, and also testing with children of folks who worked at ICF who were teens. And we found out, they said, I'm not going to download another app. I have plenty of apps. So then we tested the mobile website idea, and they told us they don't even use websites. This was news to me that the teens don't even use websites anymore. They don't even know, really, they think they know Google and how to Google for things, and then maybe they end up on a website. But more and more, what they're doing is they're inside messenger apps like Kik and Line and WeChat and WhatsApp, Facebook Messenger, right? And the capabilities within those chat apps now, a lot of the information can be presented within the messaging apps. Some of them, like Kik has a built-in browser, so they never have to leave the messaging app. And so they are on websites and they don't even know they're on websites. They don't think of it the same way that some of us think about how we go to a .com or a .gov. The whole idea of daily challenges hadn't really gone away yet, but we just found out that it's way too much. They don't want to do daily challenges. So we started adapting our thinking to things more like weekly health challenges that were a little easier to tackle. We still had all this content, you saw in the previous screenshots of the app. This was mostly text-based content, and we found out that's just not going to work. Teens really want visual, videos and images, right? And I should step back and say that the value of doing this constant user check-in throughout the design process of your communication programs, it's not just important to do with teens. I mean, these are things that we learn specifically from teens, but as you do this with your target audience, right, you're going to learn a lot of those same type of things. There'll be different elements, right, than what the teens told us, but each audience is going to have preferences that you're probably going to get feedback on and want to adapt your design throughout the process. There were even some ideas that we came up with about incorporating games into a mobile website or an app for teens and really kind of gamifying the health challenges. But the teens told us, there are a lot of really good games out there, and so if you don't have a big budget and it's not really, really good, we're probably not going to continue to engage with it very long.